Welcome to The Shield Within. The issues discussed on the Shield Within podcast do not reflect the opinions of any specific agency. They are the views of the host and the guest. Any persons discussed may be fictional for comedic purposes only. This podcast is rated explicit and listener discretion is advised. Listening to The Shield Within may trigger, repress, or suppress memories or experiences. Please contact a mental health professional at your earliest convenience. It's time for the chaos to cease.
Time to open yourself to peace.
From the hours you've put in.
To the next shift you begin.
From the endless pursuit of release.
That finds the worst unleashed.
Transform the ugly into a win.
Get to know your shield within.
And we're back. And welcome to The Shield Within. I'm your host, Marc the Cop. We don't have Dr. David here right now because I'm doing this promo a little bit later. So, if you're a fan of Facebook, and we know you are, Facebook.com/The Shield Within. Stop by, give us a like. We're trying to get up to 1,000 likes here by the end of the year. I know it's a lofty goal. But stop by, give us a like, and check out our posts we put on there every day. I'm your Facebook webmaster, if you want to call it that. I work real hard putting all that up there to entertain you every day. If you're on the internet, we know you are because you're listening to us. So stop by theshieldwithin.com. If you're in need and you want to talk to the silver-headed bastard himself, Dr. David Buchanan, you can push that coaching button. Or you can go to lessonslearnedcoaching.com. And you can reach out with him. David can see you or hear you anyway. He does telehelp. And he sees people all over the nation, which is really awesome. Next thing we're working on is Patreon. So stop by patreon.com/The Shield Within. Give us a pledge. If you like the show, you like what you hear, we'd love to have your support. That support is what is going to go directly to saving first responder lives. Because remember, the biggest thing right now is first responder suicide. So far, as of the recording of this, we're up to 77 officers have taken their own lives. This is 110% preventable death. And kind of dovetails into what we're doing here in the second half of our interview with Joe Collins and Bill Mazur. This is a incredible show. We're really excited to have them on here and to do the interview with them. So without any further ado, we're just going to jump right back into the interview. Thanks again for listening to The Shield Within.
Things that we've I think discovered and we've read from other sources is that there seems to be an intimate relationship between the individual's first responders' experiences of trauma on the job and the organizational support for the individual first responder. That if there's greater amount of organizational support, the individual first responder has a better chance of a more positive outcome. That going to treatment, having a positive outcome with treatment is related to organizational support for the individual responder. Does that resonate for any of the four of you?
Mm-hmm. No, 100%. Would you like statistics?
Yeah.
Go ahead, Bill.
We'll throw a couple because you opened up the door. So the University of Phoenix did a couple of studies on this, two actually, and asked thousands of police officers and first responders. And then the Fraternal Order of Police has just recently done one as well. And what the University of Phoenix's study showed that if a leader will actually show, like what we talked about, vulnerability and things like that, the difficulties that they've traveled through in their career, and how they dealt with those things or not dealt with them.
Yeah.
Because I'm part of the generation that they didn't teach us how to deal with this stuff.
Yeah.
We went to choir practice or you just got busy, right?
Mm-hmm. Right.
And that's just the way it was. But if a leader actually does that, there's a 71% higher likelihood someone in the organization will ask for help. A 71% higher likelihood. Now, what we do for leaders is we push back on them at this point. It's like, with knowledge comes responsibility. This is 2 studies, and the FOP supports this now, is that if you have this information and you don't act upon it, you're negligent.
Yeah.
You're negligent. When you have trusted statistical data that shows you, if you do this, the outcome is this.
Yeah.
Now, what Bill was talking about before, peer support, if a trusted peer within the organization, it doesn't have to be a formal peer support unit or whatever, someone that is the go-to, that everybody knows that that's the person, right?
Yeah. Yeah.
If that person will do the same thing, there's an 83% higher likelihood someone will ask for help. 83%.
Wow.
And everybody that shows up with all of these different things is a trusted peer to somebody.
Yes.
So now what is your responsibility? If you share, you can save people's lives.
Yes. Yes. And that is, in part, is about working with self-care. The more you work on your self-care, the more you're in a position to confidently open yourself that way to your staff.
Yeah. Because, when people go through like the 12-step program or AA and things like that, part of their healing process is actually to help mentor people through the steps.
Yes. Yes.
Because that's part of their healing.
Right.
Well, why aren't we doing that now when we understand that part of the healing of trauma is to help support other people in their path and their journey through it, and to get out on the other side and help them like release the pressure valve in their body?
Right.
Hello.
Yeah.
But we didn't know what we didn't know. We were talking about before where Mark was saying, you know what, I'm open to people critiquing us and this and that and me. But what you have to do is you have to be non-judgmental with it.
Right.
I was helping at a debriefing for a major incident, and the debriefer was critical of himself on things that happened. And I said, you know what, you're Monday morning quarterbacking yourself. Yeah. It's like, what do you mean? It's like you're beating yourself up. He's like, you're holding yourself accountable for decisions that you made with information you now possess after the fact.
Yeah.
How would you hold anyone in your organization accountable for making a decision without any information?
Yeah.
And if they made the best decision they could at the time, isn't that what you want?
Yeah.
It's like he just had like this epiphany. It's like, oh my God, I would never do that to one of my people, but I'm doing it to myself. So what we have to do is we have to recognize the fact we have to give ourselves grace.
Yes.
And because the most difficult conversations that we're ever going to have is in our own head. And being critical of ourselves and holding ourselves to a higher standard than is attainable.
Yes, exactly.
Many people say that first responders are superheroes and this and that. Have you ever experienced a superhero that their entire childhood and life was not a disaster before they became a superhero?
Exactly.
Look at Superman. His planet blew up. Batman watched his parents get killed.
Right.
Wonder Woman had no idea who her parents were.
Yeah.
For God's sakes, it's like, come on. We're not superheroes and we don't aspire to be that.
Right.
But we're human beings having this experience, and we have to give ourselves grace.
Absolutely. Yes. And as you do that as a leader, you, again, as you're saying with the numbers, 71, 83% of your people integrate that. Okay, if she can do that, then I can do that. And then it becomes, okay, that first step, which is, we were talking before we started to record, the hardest part of treatment is the first phone call. I mean, after you do that part, it doesn't get easy, but that's the hardest thing you do, is to pick up the phone, make the decision inside your own being. I'm picking up the damn phone. And then you do pick up the damn phone, and things start to happen. It's like that thing has to happen inside you first. And to share that with the people around you encourages them to do the same things for themselves. That just seems awesome. More?
Bill, go ahead.
Yeah, so Joe referenced exactly what I was talking about earlier when we talked about leadership and positional leadership, right? So a positional leader, if he or she talks about it, right, it's in the 70th plus percentile. More likely that someone will talk, but a peer.
Yes.
Not a positional leader, a peer.
Gotcha.
does it, it's almost, it's in the 80th plus percentile, right? If you had those odds, I tell you to go to the casino right now, man.
And he's from Atlantic City, so he knows casino.
I do a lot of casino references, but it's the truth, right? And that, so is that leadership? You bet your rear end that's leadership.
Yes.
Peers talking to other peers. What Joe and I get to see all the time is, so Joe and I, obviously, we've made, in the 6 years now that, well, it's actually longer than 6 years. But the 6 years I've been a full-time employee here, and Joe was really acting as a consultant even before he came on. So it's probably closer to 7 or more, right, Joe? I mean, in that time frame, we've made thousands of referrals, over 5,000 referrals, Joe and I.
Wow.
And so we get to see, a large volume of conversations, which gives us anecdotal ability to reference the things that we're saying, like the things that Joe and I talk about when it's helping somebody, or how their words can impact somebody else, or the continuity of experiences. We have a large reference of people that we're talking about. It's not like we do a referral here and there. I mean, these are thousands of conversations that we've had, and so the point I'm trying to make is this. We get to see all the time, first of all, when Joe and I speak, and we get to do, we're so blessed to be able to speak at conferences, and people ask us to come in and talk about trauma and this stuff. So we see the effect that we have, but we also get to see the folks that we've helped, Joe and I,
yes,
who've been through some pretty traumatic things, who've battled with addiction and all kinds of traumas, and then they get to speak somewhere. And the impact they have on people is just tremendous. Mm-hmm. So we get to see that. And, sometimes it's not, I mean, a lot of times it is, there's a line of people waiting to speak to us after we talk, because they identify with what we were talking about. But sometimes it comes 2 months later, where somebody calls up and says, hey, I heard, Joe speak in Wisconsin, 3 months ago. I heard, Joe and Bill talk in Kansas City or Texas last year. And, and we were like, whoa, like it feels so good, because we're like, we didn't think anybody was paying attention. But honestly, we get to see it all the time. And here's the other thing too, I'll close on this, that, Joe and I self-admittedly have said this a long time ago. We used to think that, hey, if we could only impact one life, right? But actually, in actuality, it's way more than one person all the time, because there's somebody that loves them. There's family. There's organizational family. There's always more lives that are being touched. The tentacles are going out. So it's actually never one person. It's always multiple people. It might be one person, might appear to be one person, but it's typically it spiders out into numerous people that have that interconnectedness to that person who's being impacted. So
yes, absolutely. For me, it's a very the other side of the coin is a suicide is an incredibly horrible thing, but the ripples from the suicide are what showed up in my office. The person that committed suicide never did show up. But the family members, the employees, the friends, they would be calling me and wanting to talk about the person who committed suicide. Same thing here. You throw something in the pond and you save somebody. You are an effective communicator. We talked with somebody from Windmill Wellness Ranch in Texas, and she spoke about how police, first responders, police especially, don't see each other. It's like you can have symptoms. You may be displaying red flags all over the place, but policemen don't see each other. They don't notice those patterns of behavior. And it's like we have to see each other. That makes sense to me. You see someone, you offer yourself, you engage them, and that makes their ride home better. It makes their home life better. Their wives, their children, their spouses, all their lives are benefited by somebody reaching out to that person and making a connection.
Absolutely. I heard a good analogy that somebody was explaining that first responders they're just actors, because what they have to do is they have to figure out what the scene is that they're showing up, and then they have to play the role at that moment, what they believe is needed there.
Yes.
And at some point, the play's over.
Yes.
And the thing is you got to put your costume to the side, and now who's looking back at you in the mirror?
Yeah.
And it's time to start acting.
Yes.
And you've got to take care of yourself at that point. So.
Yeah. You spoke on the episode, Joe, of leadership starts with looking inside. What's my belief system? Mm-hmm. Does my belief system fit with? Does it benefit the people that I will be, supervising or have some authority over? That just really fascinated me. So, like, as a police chief and as a deputy police chief in Bill's case, deputy chief of fire for Donnie. Wow. I mean, like, did your belief system, looking back on it, did your belief system fit? Was it beneficial? Did it change during your time in that position of authority?
Well, I think so. Because if you're truly honest with yourself, that you have to constantly grow. And so when you're growing, everything changes, awesome. Right? Because tomorrow I'm going to have a different perspective because of what I learned today.
Exactly.
And if you are stuck with the mindset, and I think that a lot of our organizations are stuck with mindsets that were 30 years ago because they haven't allowed their organization to be a growing organization, because that can be scary because it's unknown. And it's like what you say before is that when a first responder picks up that phone and actually makes the phone call that they need help, that they're admitting that they need somebody, that they need to give up control.
Yes.
And we are in a control business. That's what we're hired for. Is that when you show up, when the bell starts ringing, you best show up and control the situation. Now, when you can't control, or, we're hired as helpers and fixers, right? And when you cannot fix your own issues, then there's a lot of stigma and stuff that's wrapped around that, right? Guilt, shame, fear. And, we talked about people not necessarily trusting their organization because of how it's been treated before.
Right.
There are people that won't reach into their organizations for help because of the level of shame that's associated internally with that internal conversation saying, you hired me to be a helper. I can't help myself. I don't want to let you down. So I'm just going to suck it up, right? And I'm just going to get busy. And you know what? I'm going to default to the coping mechanisms that I have, whether they're healthy or not. And most of them that are not, because they haven't really worked the tools, right?
Right.
So what do? We have conversations, and a lot of them default to alcohol. And they become dependent on alcohol because it's the only thing that they believe that can stop the negative spin in their head with all of the visual trauma that they've seen. And maybe they can get to sleep by drinking and passing out, which we all know that's not sleeping, right? That's not the recovery system in play to fix what you need to fix.
Right.
So all you do then is you wake up in the morning in a fog because you haven't processed anything. And you know what? It's Groundhog's Day now, right? Let's just repeat it over again and over again and over again. But when they make the call and someone's on the other end of that telephone that can understand and can listen.
Yes.
And, we've, like Bill said, we've got hundreds and hundreds of alumni that have had positive experiences that all they want to do is help. And if you go to our website, you can see the video of Rob, which is my officer. Our agency was the first agency to utilize Acadia Healthcare when we were starting the officer safety and wellness stuff.
Wow.
And it's like, here it is. I'm trying to roll this program out nationally, right? And it's like, pump the brakes. You know what? We got something right here. And to follow Rob's story, it's incredible because Rob got the right kind of care. And that's why we do this, is that we've seen what happens when first responders get the right type of care and they come out the other side and now they're thriving rather than just surviving from a day-to-day situation.
Well, gentlemen, I want to jump in here with a question. We're in Ohio. Okay, you guys you're in New Jersey and Wisconsin, and what I was really taken back by when we spoke with Erica and Shannon from Windmill Wellness, Shannon, who's the CEO of Windmill Wellness, and it really struck a chord with me when I was listening to the show you were on. I feel that Ohio is behind the times. I feel that Ohio isn't putting forth their best foot to get that officer wellness to get that ball rolling. I can tell you with my own story, there's no way in heck I was going to my department and looking for resources. I reached out on my own through a friend who's that episode that's up now, and he connected me with Dr. David. What I was intrigued about was your guys' program. And I heard you, and I think Bill was talking about and all the states that you were in, but I didn't hear Ohio being mentioned. So I was so excited today that you guys are going to be on our program this evening. So tell us more about Acadia and how the program. Okay, I've hit the wall. Screw this. I'm tired of feeling like shit. What's my first digits do I push, website, etc. So whoever wants to start, go ahead.
Go ahead, Bill.
Sure. So, look, I think just to address what you were saying, I think that there's no state in the country that's doing everything correct. There's always pockets where they're doing tremendous things. They're ahead of the curve, so to speak. And then there's pockets where, they could use some work. And the truth is, most places need work, right? This is a process, and that's Joe and I's passion. That's why we do this, because we are committed to changing what we call the operational vernacular, the language, right? And when you change the language and you normalize this conversation of getting help, that's when you start seeing real cultural change.
Exactly.
That's why we're doing this.
Yeah.
But you're not alone. I'll use that phrase. You're not alone in feeling that way. I mean, every state there's pockets where we feel like there could be more done. But to answer your question directly, how does one ask for help? Well, there's many different ways that we get referrals, right? It could come from a police chief, a fire chief, a union, peer support, EAP. I mean, you name it, we get it. But the easiest way for anybody listening is helpingfirstresponders.com. Helping First, the first is a 1ST. It's not spelled out, helpingfirstresponders.com. If you go on there, scroll down, half a page, and you have Joe and I's cell phone numbers on there, our emails. So anybody can contact us. And so here's what we're really proud, to say. First of all, we work for the largest behavioral health care company in the U.S. They own nearly 300 facilities. They operate in 30 plus states in the country. They treat about 70,000 people a day in their network. Obviously, these are all first responders. This is all across all spectrums of behavioral health and disciplines and populations. But that's not just like a humble brag. We're not just spitting out numbers. Why do we say that? Because we believe that the ability to conduct outreach is unsurpassed in what we do. And it's not just, that's not a brag on Joe and I, because we have a gigantic team and resources behind us. That's what allows us to do this job so efficiently and be able to get people help. I can tell you, so, we say anywhere in the country, but we've actually helped people in different nations. We've helped federal agents and folks stationed overseas get connected. Joe can tell you more specifics on that. But we've helped people from all over. And one of the other things that we take a lot of pride in is that there has yet to be a time, and this is thousands of referrals, there's yet to be a time where someone called us and we had to say, sorry, we can't help you. Right? Now, let me clarify. I'm not saying that every one of those was a great outcome, because we don't know all the outcomes, but there's never been a time where we said, hey, sorry, we can't help you. And we take a lot of pride in that. I mean, Joe and I, we work, late nights, we work weekends when we have to, and, we will exhaust any lead. That's where our detective experience comes in, but we will exhaust any lead to get people help, because every person matters. I mean, our model is largely an insurance-centric model. So the vast majority of folks we're dealing with have insurance. Some of them are private pay clients, private pay. And then there's, occasionally once in a while, someone will come forth that has no resources, no insurance. They'll turn them away either. That's not to say we just scholarship anybody and everybody. We don't have the ability to do that, but we will find them resources, and we do it on the daily. So So to answer your question again, helpingfirstresponders.com, absolutely, they can find Joe and I like that, and you cell phone on there. Joe and I, we laugh about this. The only time we don't answer those cell phones is when we're helping somebody else.
Okay.
That's the only time we're not answering the cell phone. So I mean, we're not a hotline, so we're not a crisis line. So I want to be clear about that. I'm not answering the phone, 3:30 in the morning on the first ring.
Right.
But I will say this, that nothing becomes too important or not important to us. We're getting back to every person, and we're trying to find them the appropriate clinical resources. And so having that humongous team behind us of Acadia's network, that really empowers us to do the job that we do. And also, this is important for us, and we like to include this. We believe, Joe and I, that we Acadia sets us up for success, both on the resource side and the ethics side. And here's why. We don't work for a facility. We are not salespeople. We are not marketers. And I'm not saying salespeople or marketers are bad people.
Right.
What I'm saying is that's not our job.
Yeah.
We don't get paid by the facilities in Acadia. We work for the parent company, which is an offshoot of the parent company, which is sort of like boots on the ground, like the operations division. Mm-hmm. So we are here to help triage cases, get people the appropriate clinical care. If we can get somebody care within the Acadia network, wonderful. That's where we're always going to look first. Full disclosure, that's our employer. That's where we're going to look first. However, if it's not the right clinical fit, if the insurance doesn't work, if there's some other extenuating circumstances like their insurance policy will not allow them to leave the state or whatever,
right,
or geography becomes a big impediment,
right,
we will find you resources outside of the Acadia network that Acadia does not own. They do not make a singular cent on, but we have vetted those programs and we feel comfortable giving you them as a resource. So
awesome.
That's fantastic.
It is. It is incredible.
And a significant portion of what we do is people present at the level where they need to just find a therapist.
Yes.
And the thing is, Acadia does not hire therapists outside of their program. So that is totally outside of our network at Acadia.
Yeah.
And this whole public safety position, first responder position, was born out of the belief system that Acadia, being the largest behavioral health, mental health organization, mm-hmm, had a civic responsibility to take care of their communities and thus take care of the first responders, mm-hmm, who are taking care of the communities where they have programs. Mm-hmm. So why would you not want your first responders to be in a better state of mental health, right?
No, exactly.
And so that's where it really boiled down to, is that no one was doing this.
Yeah.
So it's like, if you call and you need a therapist, wherever you are, you could be, like Bill said, you could be in Baghdad. And you know what? And we've done this. Mm-hmm. We found a therapist for them in Baghdad.
Yes.
And across the country, because our federal partners are spread all over the world.
Yes.
And we're here to help anyone that's in the first responder community or has a relationship there.
Right.
We don't turn anybody away. Awesome. And like Bill said, we will find you a resource regardless of where your feet are. We're going to get you the help that we believe through triaging and talking, because, we do a whole lot of coaching. We're not, mm-hmm, therapists, mm-hmm, but, we're resiliency instructors, facilitators. Both of us are trained in critical incident stress management. We do a whole lot of that on the phone, right? A lot of breathing exercises, a lot of mindfulness work. Just to try to get people maybe a little bit deactivated that are activated, yes, and get them to understand that, what, we need to hit a pause button right now. Yeah. People will say, well, I can't go away for 30 days, this and that, because I got family and this. Well, what type of a family member are you going to be for the next 30 days without getting any help?
Yeah. Yeah.
You know what? Sometimes it takes you going somewhere to learn more about yourself, i.e. the academy. You had to push a big pause button on that to learn how to be a firefighter or a cop, right? Mm-hmm. Well, yeah, absolutely. They didn't teach you about this stuff. That's and right. how to be a better you. Mm-hmm. So, you know what? Let's get you connected to help you actually thrive and be a better you. Because, again, the best gift you can give to somebody else, right? Let's work on that.
Yeah.
So you talked about the academy. I'm an academy instructor. Currently, I'm an adjunct here in the state of Ohio. Mm-hmm. I also teach at our state academy. And just organically, this conversation came up the other day while my students were on break. And I was asking, and one of the kids said, "Hey, Sarge, I heard you had a podcast." And I said, "Yeah, I sure do." And started talking about the Shield Within. And I said, kind of our position here on the Shield Within. I asked any of them, I said, have they done any type of mental health work with you guys? And they said, yeah, they had a thing on Blue Help, and I could see the faces change. And I said, so I take it a lot of you thought that was bullshit. And they're like, they kind of rolled their eyes, and they said, yeah. And I said, well, let me put it to you this way, guys. I said, I've had a horrific story. I was suicidal. And I said, it takes a humble person to stand here in front of you and say that as your instructor. I said, but if you listen to the show, what we talk about and what we stress all the time is right now what you guys need to do is to reach out and find a therapist and just establish a relationship. And I said, I get it. My first few years, I was, invincible and didn't have to worry about anything like that. I said, and that's true until it isn't. And I said, then it's going to take you about 3 to 6 weeks to get in and see a therapist. I said, so what we talk about here on our show is establish that relationship now and just do like a 15-minute checkup every 6 months or so. And then I started seeing the faces change a little bit. And I thought, if we could get these people at that level embracing getting into some type of health care, I think that would get us a leg up and also destigmatize the fact that, Mark's over here on the rubber gun squad, they get the gaff look, the judgmental, I don't want to say looks, whatever, when you've actually asked for help. I know in my world, that was my biggest fear. And that's why I didn't talk about going to therapy and things like that. I had actually been in therapy for what, David?
Year and a half. Yeah.
And then we had a drowning in our city, and we did a critical incident debrief. And they're like, "Hey, Mark, how you doing?" And I said, "Well, I'm really fine. I'm okay." And that's when I decided to come out, and share with my peers that I was actually in therapy. I said I was at therapy at 11 o'clock. The meeting was at 1, and at 11 I was up at David's office. So just trying to remove that stigma.
That's significantly profound. We were about 6 years before I retired. We were doing annual wellness check-ins with everyone, and it's not just the sworn; it's the non-sworn. And they could show up and meet with the mental health provider and it was scheduled on duty. So they had a window. They could show up and talk about fishing. They could step in and say, "Hey, doc, we're good. We'll see you next year." Or they could actually come in and talk about what was going on. And when we started this, the first person that sat in that chair was me. And the second person was our assistant chief. And the next was all of our leadership team went so that when people were asking the question, what is that? They could explain to what it was because it normalized it then. And, we've helped organizations. We helped the state of Nevada actually pass the law. I testified in front of the Senate twice virtually, and they passed the law that it's mandatory now that every peace officer in the state gets a minimum of 1 session. It's a wellness check. They don't call it an assessment or anything like that. It's just, it's showing you how to insert the pressure release valve and then how to work it.
Yeah.
So that you don't become a pressure cooker without a release valve, because we know what that is. So.
Yeah, exactly.
So is that a no cost to the officer in Nevada?
Yes, it is. Yep. They did that, and then what we did is that we could do 3 sessions with our person, and then he actually was part of our insurance plan then. So we got him as a preferred provider in our insurance, so that if they had to extend beyond that, then they could go and see him on a medical status. So
beautiful.
Yeah, that's awesome.
Big recommendation by the IACP Psychological Services to have those in place.
Excellent.
And I had to call. So Bill was actually at my house. I was grilling in Texas. I live in Texas now. And I actually had a young federal agent called me. She had heard my name somewhere and said, "Hey, here's the situation is that I've got a financial planner and a coach that I'm doing really good that way. And I've got a trainer physically. I'm doing great. I got all these plans. What I need to do is I need to find a good therapist before I need one." And I'm over there. It's like, oh my God, it's the call. I got the call. And I'm looking over at Bill, and we had another one of our guys. It's like, it's the call, Bill. And it was like, that's where we need to get, like you were talking about, Mark. It was like, get all of these things in place before they happen.
Yeah.
And you know what? We help peer support teams. We help develop all of these different things. And we're recently having a discussion. It's like, why don't we pre-plan for these things to occur? Because we know they're going to.
Yeah.
So why are we not having tabletop exercises as organizations saying that, listen, what are we going to do when somebody presents and says, I've got an alcohol problem?
Yes.
And you know what? I'm actually sitting on a panel right now with the Houston Police Department, helping them develop that policy, is that they know this is happening.
Yeah.
So how do we pre-plan for someone that makes the call, either presents to our peer support, psych services, to their supervisor and says, I need help?
Exactly.
Because if we don't have a plan in place, what happens? People have to make shit up on the fly, and it's not what we want them to be doing. Or what you're doing is that you're putting the supervisor or the person that person that needs help is coming to, now they're in crisis because they want to help and they don't have a plan. They don't know what to do. So now you got two people in crisis, right?
Right, exactly. You're the person who's supposed
to. We call that, when we speak to leadership, we're talking about, executives, whether they're, whatever branch of first responder you can think of. We call this risk mitigation, right? I mean, who would put their people, right? That's largely what you engage in as leadership, or you should be, is risk mitigation.
Oh, yeah.
You plan. You do threat assessments, you do situational awareness, you make sure equipment's in place, right? That's why we go to the range. That's why we do active shooter drills. That's why, you do the dry runs from the firehouse, right? I mean, all these things, it's all risk mitigation, right? Because, when the time comes, that's not the time to establish your belief system, as we say. Right? So why should your mental health and the overall wellness of people, why should it be treated any differently? Because it actually will weaken you as a leader. And we're talking about positional leaders now, right? If you're the head of you're the CEO of an organization, what's worse than having a personal crisis come into the workplace and now you're scrambling to get stuff and you're not doing what you should be doing as the head of the agency, supporting.
Right. Yeah.
Just being right? Just being there for that family.
Yes.
Instead, you're trying to do all these other things. Have them all in place.
Yeah.
And we actually put together an organizational resilience checklist about 6 years ago, and we've probably shared this thing, 10,000 times. We'd be happy to share it with you and your viewers for free. But basically, what it is it's a collection of best practices that Joe and I put together from people who were ahead of the curve, who were doing things right. Some of the stuff in there, honestly, are ideas that Joe and I came up with. And I'll let Joe tell you about how he utilized it in his agency. But, it's basically, it's a map for you. It's a template for any organization. Doesn't matter what discipline of first responder. It's not just for law enforcement, for fire service, anyone. It's basically a self-assessment. It's meant to be a brief one-pager self-assessment questionnaire. Are we doing these things? And Joe, if you actually, you give a great example. So you want to
what we did is that we formed a wellness team within the organization, and it was some leadership, it was line officer, it was the civilian professional staff were part of this, and it's 15 questions. And the questions are asking yourself if you have these things in place. Like, do you have a peer support team? And it's not just simply a yes or no question then. So if it's yes, then a detailed response, yes. Who are the people? Who are the clinical support behind it? What's the selection process? What's the specialties of the people that are in the peer support that they can cover? It's EAP. Do we have an EAP? Yes or no? If it's a no, then what we do is we would assign it to somebody to come back and actually investigate it. And then report back to the team. So what we learned is, we had an EAP, and what we learned is they actually do training. They train supervisors on what EAP resources are there. So we brought them in to train it, because who's going to refer people to EAP?
Right.
Well, the people that are referring should know what it looks like, right?
Exactly. Yeah.
And then, do you have a confidential outside resource? If they don't want to come in to the organization and they want to reach out, well, who is that?
Right.
And then what is it going to cost? If somebody actually needs to go to treatment, what is it going to cost with our insurance plan?
Yep.
And these are things that you can also tabletop. Bill and I run a lot of test case scenarios so that if Mark wants to know, hey, what's it going to cost for me or somebody in our organization, we can get his insurance. We can run it as a test case to some of the different programs that we have. And based on, you're going to have out-of-pockets and deductibles throughout the year. But here's a ballpark that if someone has not met their deductibles, it's going to cost you X if you need to go to 30 days of treatment for alcohol problems or for trauma, because most people don't realize that most residential treatment programs, meaning that if you're going to go for 30, 45, 90 days to get help, they're substance abuse primary programs, meaning you have to have a substance abuse diagnosis, or you have to be addicted, or you have to have that situation. What happens to the people that are just struggling with trauma and they can't get past it? Well, we have a number of programs that are mental health primary programs that people can go to without a substance abuse issue. And so knowing that ahead of time and not having people go to Google to figure this out when the crisis is hitting, right? Like Bill was saying, during a crisis is not the time to change your belief system. You've got to act at that point, right? And so pre-planning, and what we were trying to do too before I left, and we really didn't get to that, is any time that we're going to activate the Emergency Operations Center because there was a critical situation where people were going to be potentially hurt or injured, having a mental health component at the Emergency Operations Center. Because why would you not want to be seeing and receiving these people that are going to be impacted by where they're going into?
Yeah, I don't know if you were looking at the looks on me and Donnie's face when you said that. And there again, that's where I'm coming back to, is here in Ohio. I mean, this is like foreign to us. I mean, it's just like, we're both like, why don't we have it there?
Exactly.
I'm sorry, Joe. Please continue.
No. Well, the thing is that you're not alone. And I tell Bill often I have these epiphanies and I fail to write them down and I forget them. But what it really boils down to is that we pre-plan everything. And I jokingly say, I was presenting in Wisconsin. I had the head of the Wisconsin State Patrol there. And I said, do you guys have a policy where your name tag goes? He goes, of course we do. Everybody has that, right? Do you have a policy on how to handle someone that's in crisis within your organization?
And that's
most people don't. So again, we just go back to the fact that it's not the one person in crisis then, because usually they're not alone. And then their supervisors are struggling because they want to help. And now you've got vicarious trauma, right? Because somebody that cares about somebody that's going through trauma and experiencing it, trauma is trauma. And the frequency that our first responders are seeing trauma far outweighs anybody else in this world. And we have to realize that we're putting them in harm's way physically and mentally. We have to change the way we do business.
So, exactly.
So, guys,
go ahead, Bill.
So it's got me thinking here. So Joe and I are the resource guys. Although we love talking about this and we are self-proclaimed nerds when it comes to this, we would talk about this for hours on end. We probably put the viewers and the listeners to sleep. We talk about it so long, but we always like to provide a tangible resource. And this is not shameless self-promotion. They could go to the website, or you could hyperlink two resources that we have that are absolutely free. The first one is the Organizational Resilience Checklist, which is what we referenced. And I can tell you that it's purposely designed to be a short and sweet self-assessment. And I can tell you this, to a person, and any person that reads this says, man, this is quality. This is quality because they're real tangible things. It was designed to be either low cost or no cost, all the things on there that you're asking yourself. And you can, so whether you're an organization who's been doing this stuff for a while or somebody just starting out, and I hear the frustration in your voice, Mark, how you say, Ohio's, lacking or whatever. Well, I can tell you that anybody could take this self-assessment and you could push the needle forward if you get the answers to these questions. I guarantee it. Because we've already done this. We've done the work for you. So that's the first one. The second resource is that we've shared, equally, probably more than 10,000 times, is the First Responder Mental Health Handbook that we put together some time ago. And it's a collection, again, of best practices. It's a lot of it's based in, evidence-based, psychology and, neuroscience and CISM. So there's a lot in there about critical events, post-traumatic stress, symptomatic features, what happens to your body physiologically. So we want to share that for free with your listeners and viewers. So we can talk about it at some point afterwards. You can either do a hyperlink to that, or if it's to help firstresponders.com. They can scroll down and hit our resources. There's tabs. Hit resources. It'll pop right up, and it's free.
Awesome.
That's fantastic.
Awesome. I love it.
Yeah.
Well,
and with your permission, we'll post this podcast out there. We've got some articles that we've written, and that, like you said, we're just nerds about trying to get out there and just the awareness that there's help.
Yeah. Exactly, Joe. And David and I were talking just today, this morning, kind of doing our little, show prep.
Right.
I talked to one of my advanced training students, and this officer, I don't know if you remember, there was a national news story where an illegal alien here in Ohio had hit a school bus and killed a child. Mm. And this officer was the second officer on the scene. And they were struggling. And as we were going through the training, it was a 3-day class, and the second day, and I said, are you seeing anyone? And this officer was like, what do you mean? And I said, mental health wise. Mm-hmm. They said, well, why do you think I need mental health? I said, because this is like the third time you've talked about that incident with me, and we've just met. Mm-hmm. And, of course, I go into that and into, Dr. David's available. Maybe it's time to find that resource. And here in Ohio, this officer was like, where do I start? And they'd been on the job 16 years. So I'm like, why? Why don't we have these resources at their fingertips? And then, of course, I listened to the show you guys were on, and I'm like, yes, I got super jacked. Especially excited that we were going to have you on our show. Is getting these resources in the hands of the people that need it. And, that's what David and I are kind of struggling with. And it was kind of the basis of the Shield Within when we got started, because I knew just how resource-less I was when I hit the wall again. That's kind of my vow or whatever is to keep those resources out there for other first responders. I think, Donnie, you were the same way, right?
For which part? Sorry.
Yeah. Just getting started with the resources and all that.
Yeah, but I was sorry. I was caught off guard with the child thing there for a minute because I actually knew the family. So.
Oh, I'm sorry.
No, it's all good. It's just kind of, it was one of the things is, I'm going back to that and just replaying that whole event in my head. Mm-hmm. But, just even at the viewing alone, it was cool as hell because they had so many different resources there with, for the kids, and they had dogs. Mm-hmm. So the canine units there, I forget what it's called. But anyways, they had the dogs going around, and that way the kids had somebody they could go up to the dog and pet it and all that other stuff. And that was just, I don't know. Sorry, that just really took me back for a minute. So anyhow,
well, that's the example that they took care of the kids, but they didn't take care of the people taking care of the kids.
Exactly.
And but the thing is that without the resources, then everybody just thinks, well, apparently I'm supposed to be able to take care of this by myself without help. And it's like, that's not necessarily the case.
And that's why I loved your analogy where you have a policy about where to put your nameplate on. Why don't you have a policy on what to do when you have a member or one of your officers that is struggling? Mm-hmm. And it breaks my heart to say this, is that I've seen time after time in my world, throughout my career, where you've had a guy that's struggling mentally and the department doesn't embrace them and help them and try and get them to a path of healing. They try to just get them out the door. Yeah. Mm-hmm. You go, just get out of here. You're drinking and you're doing this and you're doing that. So we're just going to keep writing you up till we fire you, and you can just go suffer in silence.
Right.
Whereas, why doesn't someone pull this guy aside and say, we need to help you? And then not only we're going to help you, how do we rehabilitate you or have that continuing care? Mm-hmm. How does the officer does Acadia help or give a reference for the officers that are on the job to mitigate the continuing traumas that you're going through?
Right. Yeah. And that really comes down to resiliency. And Bill and I often kind of joke the fact that Acadia actually sends us out to teach people to be more resilient so that they don't need to go to treatment. So it's an interesting business model, but it's also one of the reasons why we love this company and do what we do, because they understand it's about relationship development. Because anytime that we're talking to a group of 4 or more people, somebody in that group needs to hear what we're saying for themselves or somebody that they care about, right? And so that's really what it boils down to, is that trying to prevent the fire from happening. You know, you can't save the roof with the basement still burning, right? And we got to get at the source of what's causing these issues. And you know, we say all the time, no one in the first responder community that we've helped to get into a substance abuse program that is not driven by the trauma, either from before the job, during the job, outside of the job, or a combination of all of it. It's all driven from the trauma because they don't have healthy coping mechanisms.
Right.
And that's what we have to teach. So,
yeah, we love making that reference to our fire brethren, the fire in the basement. That's the trauma, the underlying trauma. You know, Mark, what you mentioned earlier got me thinking, and this is something that Joe and I talk about a lot, especially when we're speaking to upper level leadership. And what we say is we're trying to move the mindset away from this person is a liability, like a person who's had an issue, and move their brain into thinking compassionate accountability. We've never used that phrase, so we like to think that we coined it. We're not sure if we actually did, but we don't hear it. So we use it quite a bit, compassionate accountability. What does that mean? It means, hey, look, sometimes you have to discipline people for their own good, right? So we're not saying people, it's an excuse or people should get free passes. That's not what we're saying. We're rule guys. Discipline is needed. If not, you have anarchy, right? So people need to be accountable for their actions. However, before your mind as a leader goes to liability, what's wrong with this guy or girl? We got to get rid of them. They're bad for our image. We want you to pause. We want you to take a breath, slow things down for a minute, and think about how we could possibly save their life, their career, their family, their marriage, right? So let's go to that. And again, when you have resources in place and you make this part of the operational vernacular, this starts to become normalized. You can still keep people accountable. I mean, the truth is sometimes people need to be separated from service because it's just the situation is too complicated. Perhaps there's major discipline. Perhaps there's even a criminal offense in there that you can't reverse that, the facts of that. However, there's still no reason why you can't help that person, even if those things exist, right? Because if they separate from service and then they go even further downhill, what do you think the agency is going to look like after that? Right?
Yeah.
Suicide, or it gets worse, right? So compassion and accountability is a phrase that we use all the time. And simply what it is let's try to save people, or at least set resources up for them. The discipline's going to fall where it may sometimes. There's just no one doing that. But not every situation has to result in separation of service. And the other thing that we say to city administrators and people who or maybe even a chief of police or a fire chief has to answer to, like a city administrator or something. We give them this about, once you've employed a fire service person, a firefighter, or police officer, or whatever, or corrections, whoever, 8-9 years into the job, 10 years, you've invested over $1 million in this person, in their training, their benefits, right, their equipment, all this. So, do you want to throw that away and start over, or do you want to recognize that the repetitive exposures to the work that they're doing, that you hired them to do, it's creating some issues for them. So let's try to get them well. And then you're protecting your investment too, right? Because face it, they have to look at numbers at the end of the day, right? So now you're losing all this experience. Maybe you're, there's going to be far greater personal loss for them if you were just to fire them. So that's sort of what we talk about with compassion and accountability.
And I love that terminology. And Bill, you were, that's part of the point I was trying to make, was that you've had so much time, energy, investment, experience into this officer, whether it's fire service or police service or EMS, either way, instead of letting this guy or person, because they're just in a bad spot right now, and that's temporary. Can we get them over that hump? Can we put them on, a 30-day or a 60-day program, and then bring them back? And everyone is like, a lot of people that's been through the program, you got to do the work. That's the biggest thing. And we all agree that doing the work just sucks. But once you get on the other side of it, I saw a meme the other day. So, be good to yourself because your future self will thank you for starting this process. And to get back to what David said earlier in the conversation, is that first call, like with Save a Warrior, everyone says the hardest part about the process was pushing the submit button, or taking that first step in the 1,000-mile journey. It's difficult, but I can tell you today, as I stand here now on this program, sharing the mic with you all, and I'm very honored and proud to do that, was that, get there. And how do you get there? And you can be resourceful. But what we need, I think, in our world and in our orbit is having that mindset by management or leadership here in our area to accept it and to have the plan set. And I don't know of any agency within our area, the Dayton, Ohio area, that has something like that. That's a plan in place. I would like to know if anyone hears of it, listening to this, please reach out on our social media and send me a message.
Yeah.
Well, we're going to hear that your agency actually started this at this point. So that's we can help you guys form the template, and then everybody will replicate what you're doing.
Yeah, that'd be awesome. Absolutely awesome.
Beautiful place to start. Gentlemen, I'm guessing we're close to our time.
We are. We're an hour and 41 minutes, and I tell you what, I could talk another hour and 41 minutes. But Bill's got a game he's got to go watch. So.
That's right, man. Thank God it's on DVR, man. Thank you, Joe.
Yes.
Thank you, Bill. This has been awesome. It's everything I dreamt it would be. I knew having your input would be really wonderful, stimulating for all the people here on the table, but all the people that listen to our show. So thank you enormously. We've jotted down all those resources you've mentioned. We'll be passing them out along to the people that are listening to our episodes. And again, as I said at the very beginning, I'm already issuing you another invitation.
Yes.
We want you back. We have a lot of stuff to explore, but this is what I really wanted us to focus on today was leadership, and you've done a beautiful job of it. Thank you very much for being with us.
Thank you both.
Honor to be here.
Thank you, gentlemen, for what you do and for sharing.
Thank you.
Any last minute websites, contact information, or anything like that, gentlemen?
No, like Bill said, that helpingfirstresponders.com, that access to us, and there's a bunch of resources on that website too.
Good.
That can help.
Very, very good. Awesome.
Very good.
Thank you, gentlemen. Enjoy the rest of your week.
Thank you.
All righty. Thank you.
May your days and nights find you strong and safe. May you take your place as your family's face. As you do the shit that we won't do. As you embrace the risk you must go through. May you grow in strength and heal and find your heart, your soul, and your mind. You look at your life and grin. You have a home, the shield within.